Stopping the way you eat these 10 types of vegetables could help your body feel lighter and significantly lower your risk of stroke and heart attack. What truly surprised me is how many older adults, despite believing they are eating healthy, unknowingly consume these vegetables every day without realizing they may be silently harming their heart and brain. In this video, I will clearly explain which vegetables require caution, because if you don't understand the proper way to prepare and combine them, you could be unintentionally weakening your health. This list can be misleading without proper context, so I'll walk you through each step to help you avoid unnecessary risks, stay healthy, and enjoy a full and active life with the people you love. First, pay close attention to spinach. Why is this important? Spinach contains a very high amount of vitamin K1. Just one small bowl can have 4 to 5 times the daily amount your doctor recommends. For people over 60, especially if you are taking blood thinners like warfarin or aspirin, eating a lot of spinach or changing the amount you eat too often can make your medication less effective. Your blood can get thicker and your risk of blood clots will go up. This is not rare. Every year in the United States, more than 33,000 seniors are hospitalized because of interactions between leafy greens and blood thinners. I once met Mr. Smith, who is 68 years old. He used to switch up his meals, sometimes eating a lot of spinach and other times stopping completely. As a result, his blood numbers were unstable, and once he even had to be hospitalized because his blood was too thick. But after he made a simple change, eating leafy greens more consistently and checking with his doctor, his health became much more stable and he did not have to worry about complications anymore. Here is an important warning. Do not be careless with leafy greens, especially if you are taking blood thinners. The best thing to do is to eat them in consistent amounts. Do not change too quickly, and always ask your doctor if you want to change your diet. With just this small change, you can keep enjoying delicious meals, protect your heart and your mind, and stop worrying about stroke or blood clots. Are you currently taking blood thinners, or have you ever felt unsure about eating leafy green vegetables? If so, share your story or experience in the comments below. Your personal insight might help others facing similar concerns find a safer, more informed path to protecting their health. If you want to keep your blood pressure steady, pay close attention to pickles. Why is this important? When you cut back on pickles, your sodium levels also go down. This helps prevent sudden spikes in blood pressure, lets your heart work less hard, and gives better protection to your blood vessels. Over time, your heart will stay healthier, your risk of stroke and heart attack drops, and you can live more confidently without worrying about dangerous complications. I have met many older adults who struggled with high blood pressure, swollen legs, and shortness of breath. Just by making a simple change, eating fewer pickles and choosing fresh foods instead, their health improved a lot. They slept better, their heartbeats became steadier, walking felt easier, and they no longer worried about surprise heart problems. The thing is, many people do not realize that just a few pieces of pickles can push your sodium intake above the safe limit for the whole day, putting a lot of pressure on your heart and blood vessels. If you keep eating pickles often, your risk of stroke, heart failure, and kidney swelling can go up every day without you even knowing it. The solution is very simple. Eat fewer pickles, go for fresh vegetables, and watch how much salt you have at each meal. Your body will notice the difference. You will feel lighter, stronger, and your mood will improve every day. And watch out, the next vegetable can quietly make your heart race and raise your blood pressure after just one spicy meal. Have you ever cut down on salt or changed the way you eat pickles? How did it affect your health? Share your experience below so others can learn from you. If you want to enjoy your meals without worrying about your heart, pay close attention to red chili peppers on your table. For older adults, especially anyone with high blood pressure or heart problems, eating spicy foods, especially red chili peppers, hot sauce, or chili powder, can make your heart race, raise your blood pressure suddenly, and leave you feeling jittery or tired. When you eat spicy food in moderation, your heart rate and blood pressure stay in check, which helps your heart work more easily and lets you feel better all day. Many seniors have told me that just by cutting back on spicy foods, they feel less anxious, their hearts beat more steadily, and they even sleep better at night. One person told me, just by eating less spicy food, I sleep soundly and don't worry about my heart anymore. Do you like spicy food, or have you ever felt your heart race after a spicy meal? Share your story or experience below. You might help someone else realize the effect of this habit sooner. The problem is, a little bit of red chili, hot sauce, or chili powder sprinkled on your pizza can make your heart work overtime without you even noticing. For younger people, it's not a big deal, but as you get older, it's much easier to experience dangerous reactions like irregular heartbeats, chest pain, or even heart attack or stroke. You do not have to give up spicy food completely. Just try to reduce the amount of red chili in your meals, especially if you have a history of heart problems or high blood pressure. Choose more natural flavors so your heart and blood pressure get a break every day. It really is that simple, and you will notice the difference. Raw garlic has long been considered a natural antibiotic that helps lower cholesterol, supports blood pressure, and is trusted by many people to help prevent stroke, even as a natural alternative to medication. In fact, when used properly, raw garlic truly offers many benefits for heart health. It helps blood flow smoothly, relaxes blood vessels, supports healthy blood pressure, and lowers cholesterol. However, to get these benefits safely, especially for older adults who are taking blood thinners like aspirin, warfarin, or clopidogrel, you need to pay attention to the amount and the way you use it. Allicin, the main active compound in raw garlic, can boost the effect of controlling blood pressure and help blood flow better, which lowers the pressure on vessel walls and helps protect your brain and heart over time. But if you eat too much raw garlic or use it along with blood thinners, it can make your blood too thin. This could lead to side effects like dizziness, low blood pressure, or even mild bleeding, especially in older adults. I once had an older patient who quickly recovered after adjusting how much raw garlic she ate, keeping the amount steady each day, and working with her doctor to manage both her medication and her diet. Thanks to this, her blood pressure became stable, the dizziness went away, and she could still enjoy all the heart health benefits of garlic. So if you want to use raw garlic to strengthen your immune system and protect your heart, remember to use the right amount, keep it consistent, and always check with your doctor if you are taking blood thinners. That way, you get all the benefits of garlic without worrying about unwanted side effects. Now, the last food I am about to reveal is actually the most dangerous culprit that 99% of older adults believe is completely safe. In fact, it can raise your risk of stroke and heart attack faster than any other food, all because of one very small daily habit. 5. Raw sprouts. Many people believe that eating raw sprouts or bean sprouts is a clean eating choice that adds enzymes and helps the body detox and stay healthy every day. For anyone concerned about heart health, choosing raw sprouts seems like a wonderful natural solution. But the truth is, if you really want to keep your heart strong, stay happy, and enjoy your golden years without worrying about complications, eating raw sprouts may not be the best option. When you switch from raw sprouts to cooked vegetables or lightly blanched veggies, you greatly reduce the risk of harmful bacteria getting into your body. This helps your immune system stay balanced, protects your heart, and lowers the chance of blood infections or heart infections. So, how can you enjoy vegetables and still feel safe and healthy every day? It is simple. Just switch from raw sprouts to vegetables that are cooked, steamed, or at least blanched in hot water. By doing this, you remove most of the harmful bacteria, make things easier for your immune system, reduce the strain on your heart, and keep your life active and enjoyable for longer. Many older adults have told me that after making this small change, they feel healthier, enjoy their meals more, and no longer worry about hidden risks to their heart. And if you think sprouts are already a challenge, just wait for the next fruit I am about to reveal. It can turn your heart medicine into something dangerous, all because of one simple daily habit. 6. Vegetables that interfere with heart medications. If you are taking heart medication and want your medicine to work its best to protect your heart every day, it is important to pay attention to just a few common vegetables and fruits. Many studies show that some foods we think are healthy, like grapefruit, broccoli, Brussels sprouts, or even green tea, can actually change the way your body processes medication. For example, just drinking grapefruit juice for 3 days can double the level of certain blood pressure medicines in your system. This can lead to unexpected side effects that most people do not realize. I once met a 73-year-old patient whose blood clotting numbers dropped a lot after she started having green smoothies and green tea every day, even though she was still taking her medicine as prescribed. This raised her risk of stroke without her knowing it. The solution is very simple. When you are on heart medication, always check the types of vegetables and fruits you eat. Limit or talk to your doctor before adding things like grapefruit, green tea, or broccoli to your daily routine. This will help your medicine work as it should, keep your heart healthy, and help you avoid risks that are easy to overlook. And coming up, I will reveal a vegetable that can actually help you breathe easier and avoid chest tightness or heart fatigue after meals, but only if you eat it the right way. In reality, raw cabbage is part of a group of vegetables that can create a lot of gas in your system. As your digestion gets weaker with age, the substances in raw cabbage, called FODMAPs, are not fully digested and start to ferment, producing extra gas in your gut. This gas can make your stomach feel bloated and puts pressure on your diaphragm, leaving less space for your heart and lungs to work comfortably. For younger people, it is just a mild discomfort, but for older adults with heart conditions, valve problems, or weak lungs, this can lead to shortness of breath, a pounding heart, or even tiredness that lasts long after a meal. I once met a 75-year-old man who simply switched from raw cabbage salad to lightly steamed cabbage. After 2 weeks, he no longer felt short of breath or tightness in his chest after lunch. The solution is very simple. Try swapping raw cabbage for steamed or lightly boiled cabbage. This method removes most of the gas-producing FODMAPs and relieves pressure on your heart and lungs, so you can enjoy your meal without worrying about chest tightness or trouble breathing. Many people who have made this small change have kept their hearts healthy, still enjoy their meals, and do not have to worry about lingering discomfort. And be careful with canned, salted, or long-preserved vegetables. The impact they can have on your heart health might be more serious than most people realize. 8. Canned vegetables. Canned vegetables are a popular choice for many older adults because they are convenient, easy to store, and ready to eat as soon as you open the can. But there is a truth that not many people notice. Many types of canned vegetables contain extremely high levels of sodium, enough to cause water retention, make blood pressure spike, and force your heart to work much harder after a meal that seems light. According to the USDA, one serving of canned green vegetables, about 120 grams, can have anywhere from 300 to 600 milligrams of sodium. That is 15 to 30% of your whole day's recommended sodium limit just in one bowl of veggies. If you also eat canned soup, processed foods, or simply add soy sauce at the table, your total salt intake can go way over the safe limit without you even realizing it. For anyone with high blood pressure, heart failure, kidney problems, or a history of stroke, this situation increases the amount of circulating blood, causes fluid retention in the lungs and tissues, and makes the heart pump harder and faster under high pressure. A study in the journal Hypertension showed that just going over 2,300 milligrams of sodium per day increases the risk of stroke by 20% and the risk of heart failure by 28% compared to those who eat less than that. Canned vegetables are one of the main contributors to this extra sodium. In addition, many canned vegetables contain preservatives like sodium benzoate, BHA, or artificial citric acid. These do not cause instant harm, but if you eat them often over time, they can damage the inner lining of your blood vessels, raising your risk of artery disease and blood clots, two main factors behind heart attacks and strokes. I once had a 68-year-old patient who lived alone and ate canned vegetables every day because she had no time to cook. When she was admitted to the hospital with shortness of breath and swollen legs, her blood pressure was 180/100. After she cut out all canned foods and switched to fresh vegetables, her blood pressure slowly dropped back to safe levels within 3 weeks, just from this simple change of dropping 1 can of vegetables a day. Canned vegetables are already risky, but detox juice kings can quietly lead to insomnia and heart rhythm problems. 9. Celery. Celery is one of the most talked about vegetables of the past decade. From starting your day with celery juice to fat-burning celery soups, it is praised everywhere as a miracle for health. But if you are over 60, especially if you have high blood pressure, irregular heartbeat, or trouble sleeping, celery might not be as harmless as it looks. For some seniors, celery actually acts like a mild stimulant, making your heart and nervous system a bit more active than you might want. Why is that? Celery contains two natural compounds, apiol and phthalides, found in both the stalks and the leaves. These gently stimulate your adrenal glands, causing them to release more adrenaline and cortisol. That can mean your heart beats a little faster, your blood pressure goes up a bit, and your mind stays more awake even when you want to relax. For younger people, or those in perfect health, this can feel like an energy boost. But for people over 60, even small changes like these can upset your body's balance. Just a few extra heartbeats per minute, a small rise in blood pressure, or nights of restless, shallow sleep are all signs your cardiovascular system is being overstimulated day after day. A study published in the American Journal of Hypertension found that drinking concentrated celery juice every morning increased heart rate by 5 to 10 beats per minute in older adults after only 14 days. This was especially clear in people with mild arrhythmias like occasional atrial fibrillation. Celery can also trigger mild allergies in some people, such as skin rashes, stomach discomfort, or a strange jittery feeling that is hard to explain. While these symptoms are not dangerous on their own, over time they can put extra stress on your heart, making it work harder in a body that is always a little on edge. That slowly wears down your heart's strength and ability to recover. Celery might give your body a gentle push, but the last group of vegetables we will talk about puts real strain on your kidneys, and your heart ends up paying the price in a dangerous downward spiral. 10. Oxalate-rich leafy greens. Spinach, beet greens, and Swiss chard often show up on lists of so-called superfoods, especially for people who want to eat clean. They are full of vitamins A, C, K, magnesium, and antioxidants. But there is a serious risk that is rarely discussed. All three are extremely high in oxalate compounds, which can build up in your kidneys, form sharp crystals, and lead to kidney stones or even kidney damage. This risk is especially important for people over 60, anyone with a history of kidney stones, or those with unstable blood pressure. So what exactly are oxalates? They are natural compounds found in many plants. When oxalates enter your body, they bind to calcium and form calcium oxalate, the main ingredient in more than 70% of kidney stones. Here is the problem. As we get older, our kidneys do not filter as well as they used to. So if you are eating a lot of high oxalate vegetables every day, those tiny crystals can slowly build up, and you may not notice anything until you start to have complications. A study in the Clinical Journal of the American Society of Nephrology found that people who ate the highest levels of oxalates from leafy greens had a 2.5 times greater risk of developing kidney stones compared to those who ate moderate amounts. To give you an idea, just 1 cup of cooked spinach contains up to 755 milligrams of oxalates. But if you are at high risk, experts recommend staying under 100 milligrams of oxalates per day. Kidney stones are not just painful, they can also raise your blood pressure. When your kidneys lose some filtering power, sodium builds up, fluid is retained, and your body turns on hormones that increase blood pressure. As the kidneys struggle, your heart has to work harder to push blood through, starting a dangerous cycle of kidney damage, rising blood pressure, heart strain, and eventually stroke or heart failure. So, now that you've seen the 10 vegetables seniors should be cautious about, the big question is this: what should you eat after 60 to truly protect your heart and arteries? The answer is coming up, and it might be simpler than you think. Here are some of the most heart-friendly, easy to digest, and low-interaction veggies for older adults. These don't interfere with your medications, and they actively support your heart, blood vessels, and brain health. 1. Green beans. They're rich in fiber, low in oxalates, and unlikely to cause gas or bloating. Green beans also contain flavonoids, which are natural anti-inflammatory compounds that help lower blood pressure. You can steam, lightly sauté, or boil them with a little olive oil. 2. Steamed broccoli. When cooked just right, not overdone, broccoli increases the bioavailability of sulforaphane, a powerful compound that improves blood vessel function and lowers LDL, the bad cholesterol. 3. Cooked carrots. High in beta-carotene, a strong antioxidant that protects your heart cells from oxidative stress. They're gentle on the digestive system, don't cause gas, and are perfect for older adults. 4. Zucchini. Low in calories, high in water, and potassium, an essential mineral that helps regulate blood pressure and supports heart function. Cooked zucchini is very gentle in the stomach and ideal for people with heart failure or bloating issues. 5. Cooked tomatoes. Cooking tomatoes helps release lycopene, a powerful antioxidant proven to reduce the risk of heart attack and stroke. One study published in the Journal of Nutrition found that people with high blood levels of lycopene had up to 55% lower risk of stroke compared to those with low levels. Now, let me be clear. I'm not saying you should stop eating vegetables, but you do need to be smarter about how you choose and prepare them. Ask yourself, do you really know what you're putting into your body? Do you know what your body can handle and what it can't anymore? Are you cooking your food in a way that supports your heart, not stressing it? At this stage in life, it's not about trendy superfoods. It's about foods that help your heart beat steadily, your blood pressure stay calm, and your brain get the oxygen it needs so you can stay strong, sharp, and out of the hospital for years to come. If you found this video helpful, hit the like button to help others access this important health information. And don't forget to leave a comment below. Are you currently eating any of the vegetables I just mentioned? Have you ever experienced unusual symptoms after a meal without knowing why? I read every comment and may respond to yours in an upcoming video. Thank you for watching, and I'll see you again soon with more content on heart-healthy eating and stroke prevention.